now to bring on board Dr. Vinit Samdani. I've personally interacted with him also in a professional capacity, and I can say that he's certainly one of the best pediatricians we have in Mumbai. Dr. Samdani, fantastic to connect with you, even though we are connecting on a different forum this time. Hope things are well with you.
Thank you, Nikunj. Things are good.
Dr. Samdani, the concern for a lot of parents is that COVID is now affecting children, something which was not there in the first wave. Is this the differentiating factor about the second wave?
So yes, as a matter of fact, COVID is affecting the kids more. But do realize, Nikunj, when we had the first wave, we were in a complete lockdown, number one. So all the kids and everyone were at home and their mobilities were extremely restricted. Now, this is coming as a double mutant strain, which is London, Brazil, and South African strain, which supposedly is affecting the kids more.
Protocols which essentially have to be followed for children who are getting affected because of COVID, because for adults we know what's the procedure and what is the what are the medicines which need to be administered.
So for kids, what's happening is we've got a rise in the numbers because we've got play dates, we've got little toddler mother programs. They're socializing in their building, on their playground, they're meeting other friends. So the COVID appropriate behavior for the kids have been extremely lax. And interestingly, what we have observed is that every child that turns out to be COVID positive, there's an adult at home that is positive. So whether it's the child that's transmitting the infection to the adults or the adults are silent and they're asymptomatic carriers and affecting to the kids, nobody really knows. But yes, to my understanding and to our experience, that every child that's infected, there are at least 2 or 3 adults at home which are infected. And the protocol remains the same. The child would have, what we've seen is the beauty is that the cases are very mild, Nikunj. So there's fever 9900, which lasts for 24 to 36 hours. So there's no real panic story. We treat with paracetamol and 99% of them in the next 24 to 36 hours are settled without fever and then they're fine.
Are you getting cases where the child or children in this case, they also have to be hospitalized? Have you seen cases dropping to such levels?
So as of now, in this wave, no. But in the last wave, I had a child that was 45 days old, which was hospitalized, but came out safely, required supportive care with oxygen, IV maintenance, and supportive medications and came out well. But as of now, in this wave, all the kids that I've seen are doing well at home.
We pretty much know the protocol what an adult has to follow, which is keep on checking your saturation level, keep on monitoring your blood pressure and your temperature, and if temperature goes above a threshold and oxygen goes below a threshold, you must get in touch with the doctor. What are the necessary protocols which a parent needs to administer if a child gets COVID?
So at the moment, we measure the temperature. Anything more than 99, you need to give paracetamol and keep it every 6 hours. Now, the problem is with infants, toddlers, and small kids until 5 years, taking saturations is not really easy because their thumb doesn't come into the infrared light that it can be picked up well. But if there are no supporting complaints, as in respiratory problems, if there's no much cough, then I think paracetamol just needs to be there. Look at the range of fever. Look if there's rash, if there's diarrhea, there's redness of eyes, or if there's nausea, vomiting, pain in abdomen, just inform the doctor.
So, Dr. Samdani, just want to understand, as of now, basis the kind of trials that we're seeing and the kind of talks that are underway, it seems that, vaccines for even those above the age of 18 is still going to be a long time away. So, basis the kind of progress that we're making on the vaccination, when do you think that something could probably emerge for younger children?
So for vaccines for the young, the Moderna says that they're doing the trial between 2 years to 12 years. But I think that's going to be taking time and the results would be out in October. And the Pfizer says that 12 to 16 years, they are with it. But I think by the time it reaches India, it's going to be at least year end. Until then, we'll have to just stay safe, stay protected, stay indoors with the kids. And the adults also have to be COVID appropriate behavior.
Just wanted to understand from your perspective, because we're interacting with as many medical professionals as well as doctors, as to whether or not this is the right approach to adopt in India, to take these sort of severe measures of a lockdown, ensuring everyone stays indoors. Do you think that that is the only resort that we can take, or perhaps measures that aren't as stringent need to be adopted in order to curb the COVID spread?
I think that there should have been a little more stringent action much before time. We've now reached the peak and we are not exactly in a lockdown, but we are under strict vigilance, because everything in the daytime, it's the way it is. Everything is on except shops are shut. Only essentials are on. So for kids, yes, the kids should stay indoors. Should not have play dates, should not go to schools or toddlers, mother toddlers, or meet other friends. And for the adults, well, mask, COVID appropriate behaviors is a complete necessity, and socializing needs to come to a halt or to minimal until extremely necessary. That's the only way probably we'll be able to break the graph, and we would be able to stop also the kids getting affected.
Dr. Samdani, my 9-year-old, every time I tell him not to go down and play, he says, I want to watch more TV or play more video games. What am I supposed to tell him as a father?
Nikunj, this is like a catch-22. I think you should try and play with him. You can probably, if your building has an tennis or a badminton or a table tennis, which is there, you should try and play with him, but try and convince him, or with a pinch of salt, he can do online classes and study.
Well, that was indeed a tough one to answer, but really appreciate your time, and thank you once again for joining us, and thank you once again for all the relentless effort which you, your team, and the entire medical fraternity is doing to keep all of us safe. Really appreciate that.
Pleasure, Nikunj. Thank you.